You're pregnant? And you're having trouble sleeping? Your body may experience damage during pregnancy. Sleeping is essential throughout pregnancy, but it isn't always easy to get enough of it. Know why you're feeling fatigued and how being pregnant affects sleep, and what you can do to get a good night's sleep. How can being pregnant affect sleep? Your ability to sleep during pregnancy may be affected or disturbed by a number of common symptoms, such as nausea and vomiting, often called morning sickness, and regular urination. Uncomfortable physical symptoms like sore breasts and back pain, fetal movement, leg cramps, heartburn, snoring, irregular uterine contractions, shortness of breath, restless leg syndrome, and even worry about birth and delivery can all play a part. Pregnancy can make sleep disorders, such as sleep-disordered breathing, worse. What is the best position for sleeping? Experts have traditionally said that the best sleep position when you're expecting is on your left side, though your right is also perfectly acceptable. Once you're past your first trimester, it becomes impossible to lie on your stomach for obvious reasons. Sleep on your side. Avoid lying on your back, which can strain your back muscles and spine from the weight of your uterus. But if you wake up on your back, don't worry. Use pillows. You can get more comfortable by placing pillows carefully. Consider putting a pillow beneath your belly or between your bent knees. So, what actually happens when you sleep on your back during pregnancy? Well, some experts recommend that pregnant women avoid sleeping on their backs during the second and third trimester. And why is that? The back sleep position, basically rests the entire weight of your growing uterus and baby on your back, your intestines, and your vena cava, which is the main vein that carries blood back to your heart from your lower body. This kind of pressure may cause backaches and hemorrhoids, and can even make digestion less efficient, interfere with your circulation, and possibly cause hypotension or low blood pressure, which might make you feel dizzy. But still, don't worry if you wake up and find that you've rolled onto your back overnight. Let's talk about the benefits of sleeping on your left or right side during pregnancy. During the second and third trimesters, sleeping on either side, preferably the left if you can, is considered by some experts to be ideal for both you and your baby-to-be. This position allows for maximum blood flow and nutrients to the placenta, which means less pressure on the vena cava, and it also enhances kidney function. That means better elimination of waste products and, hey, less swelling in your feet, ankles, and hands. So, what if you fall asleep on your back while pregnant? Well, here's the thing. Very few people spend the entire night in the same position. So, don't worry, I'll say it again. If you awaken from a pregnant nap on your stomach or back, nothing negative happened. Your body is probably trying to advise you to shift positions by waking you up in the first place. And maybe it's telling you to go to the bathroom again, which is another common pregnancy sleep problem. But, is having too little sleep bad for you or your child? Try not to worry if you're not getting as much restful sleep as you were before you became pregnant, because the great majority of pregnant women do experience some difficulty sleeping. However, studies have indicated that women who consistently get less than 6 hours of sleep each night may experience lengthier labors and are more likely to require C-sections. So, it's something to keep in mind. Untreated sleep apnea has been associated with pregnancy issues like preeclampsia, gestational hypertension, and low birth weight. Untreated sleep apnea causes frequent breathing disruptions throughout the night, which leads to poor sleep and waking up during the night. So, if you suspect you might have this problem, it's really important to consult your doctor as soon as possible. Not sure if you're getting enough sleep? Honestly, the greatest method to assess is how you feel, not just how many hours you spend lying in bed. You're not getting enough sleep if you discover that you're not sleeping and are consistently tired, beyond the typical pregnancy fatigue. Speak with your healthcare provider if you believe that not getting enough sleep is becoming a problem. He or she can assist you in identifying the source of your issue and potential treatments so that you may get the rest you require. How can I get a good night's sleep? Well, when you're pregnant, you can take action to control sleep issues. Examples include establishing the mood, the right temperature, along with a quiet, peaceful, and dark environment can really promote sleep. You may have better sleep quality if you go to bed and wake up at the same time every day. And your bedroom should be free of electronics. Stay active. While pregnant, regular exercise may make it easier for you to fall asleep. Oh, and avoid heartburn. Eat frequent, little meals throughout the day, and try to refrain from eating 3 hours before night. Heartburn sensations can also be lessened by sleeping on your left side while elevating your head. Develop your relaxing skills. Performing these before going to sleep might be beneficial. Speak with your healthcare practitioner if you experience persistent sleep issues while pregnant. The Cognitive Behavioral Treatment for Insomnia Talk Therapy program is one approach. This program teaches you how to recognize and replace negative thoughts and actions with positive ones that either prevent or worsen sleep issues. Low-dose prescription medicine may be helpful if your sleep issues are severe and chronic.